Women's Health Wednesday now. April is Sexual Assault Awareness Month. So this morning, we're talking more about sexual violence affecting people of all ages. And nurse practitioner Nancy Harris, manager of the Forensic Nursing Program for St. Peter's Health Partners, joins us now with what everyone needs to know, including the supports available to everybody in our community. Nancy, thank you so much for being here.
Thank you.
I think we're going to put up on our screen as soon as we can the crisis hotline number for those who are affected by suicide violence. There it is on the screen. We're going to keep that number up for everybody. I know, Nancy, we're going to talk about that a little bit more coming up. But first, just looking at some of these statistics, you know, they're disturbing. 1 in 4 women and 1 in 26 men have experienced rape or attempted rape. And that's just one form of sexual violence.
Correct.
Talk to us about sexual violence overall, the definition, but the different forms that are out there.
So there's several different types of sexual violence, and some can include sexual assault and rape. Others can include extortion. It really depends upon the age, everything that is going on with the person. Intimate partner violence, domestic violence. It also, harassment is another form of sexual violence.
Talk to us more about it being the lowest reported crime, because this is something that needs to be talked about so much more, and yet it's not. Why?
So many people feel that it's their fault, and they don't feel as if they're going to be believed. So they feel as if they don't need to get help or, have this person arrested. And so they are very concerned about that. They're embarrassed. And that's why it's so important for patients to know where to go to get help so that we can let them know that we believe them.
I know you're a busy lady and you see a lot of people and offer a lot of support. So let's talk about St. Peter's and some of the programs that are available for those who are in need.
Sure. So with St. Peter's Health Partners, we have 3 major hospitals, Samaritan, Albany Memorial, and St. Peter's Hospital, that patients can come to for, help. And we always try to stress that it's not always about collection of evidence, but it's about making sure that their body is okay. We also have a child advocacy program that we cover 32 counties. And what we do there is we provide medical exams for children. And we also have New York State TeleSafe program.
Yes. Tell us a little bit more about TeleSafe, because this reaches people that might otherwise not be able to be helped, right?
Correct. We're very lucky in our area because we have the services, ready. Many of the locations, rural locations, even in the larger cities, you can't find 24/7 coverage, for a sexual assault nurse examiner. So TeleSafe is there to provide that support for the patient, and also to be able to help any nurse through the exam process from start to finish.
So is it virtual? Some component is virtual.
It is.
Okay.
It's virtual, so our nurses are across New York State.
Yeah.
And they provide this service virtually. And it's great for the patient because the patient shouldn't have to worry about which hospital they go to for what they need. They should be able to walk in anywhere and get the services that they need. And that's what TeleSafe really was built for, is to provide that for any patient.
One more thing. What can you say to someone who may be watching at home and has been the victim of sexual violence, and they are afraid to speak up, but they are struggling? Why is it so important that they speak out and get help?
It really is. It's important for their mental health because it's something that can be triggered at any time. And we always feel that if they take the time to talk with a medical person to make sure that their body is okay, it's the first part to healing. And then, with St. Peter's Health Partners, we have an incredible 24/7 hotline, and we want patients to be able to reach out, talk to somebody, whether it's 2 o'clock in the morning or 2 o'clock in the afternoon, reach out and talk with somebody.
And that's what that phone number is all about. And to find the other resources that you mentioned, TeleSafe, where can people find that information real quick?
They can find it all on St. Peter's website.
Wonderful. Nancy, thank you so much.
Thank you.
An important topic. We really appreciate you coming and talking about it.
Thank you.
You can find all of our Women's Health Wednesday segments online. Go to news10.com and look for Women's Health under the Community tab.